So let's answer the question, what are anxiety disorders? Now, we said earlier that anxiety is normal. It's a normal feeling. However, we do have a group of mental illnesses that we call anxiety disorders. And these are disorders that cause one person to have excessive worry and fear, and that causes them to avoid the situations that trigger that. And this excessive fear and anxiety can cause them to miss work, basically to avoid social gatherings, or even to avoid the stimuli that is causing them to experience that uncomfortable feeling of being anxious. And so we have several types of anxiety disorders that we'll be talking about, but basically for it to be a disorder, we want to look at how it's affecting your personal life, functioning in your personal life, functioning in your occupational life, and functioning in the society. Once you find that your anxiety is causing you to be dysfunctional or to have maladaptive behaviors within those three areas, socially, occupationally, and also personally, then you know that you have entered into now the disorders area, and your anxiety has gone beyond being normal anxiety. Let's talk about types of anxiety disorder. One of the ones that is very common, that usually a lot of people may not realize they suffer from, is what we call generalized anxiety disorder. Now, generalized anxiety disorder is what the general population experiences. And this is more excessive worry that is not reasonable about everyday life. So you're just worried about things. You are not able to relax. So if you want to know someone who has generalized anxiety disorder, whenever you want to do something, they always have to ask you, have you thought? They kind of have to throw some negative thing or outcome about that particular thing that you want to do. For instance, you decide that you are going to move from one estate to another because the houses are better there. Their first question is, are you sure you can afford it? So that is a person who probably has a general fear of the unknown. I would say that it's a spectrum because it's normal. That's a normal question. First of all, if you're going to move from one estate to another, you want to know, can I afford it? So that is normal. However, there are people when it paralyzes them and they are not able to function. They can't make a decision because they are worried about, am I going to afford? What about next year? Will I have to move again? And so they cannot make a decision because they are predicting what the future is going to look like, and that causes them not to be able to make decisions about things in life. And so you find those people, they tend to mark time in a job because they are thinking, if I leave this job, what about if I go to the other job, it doesn't work out? And they are not able to take risks in life because they have that general feeling of the fear of the unknown, or bad things happening, or them losing control over their own life. Then we have what we call panic disorder. And panic disorders are usually something happens, there is something that has happened that causes you to go into a panic mode. And this panic disorder, the reason why it's different from normal fear or normal panic is because it causes you to really feel an intense feeling of losing control, or being unable to do a lot of things like breathing. You feel you have trouble breathing. Your heart is almost beating out of your chest, and you have sensations like shaking. You have sensations like I can't breathe. You are palpitating. Your blood pressure is off the roof. And usually people who have panic disorders, they will say that normally their chest will close up. They feel like they are going to die. It's a very debilitating disorder because you have chest pains as if you are having a heart attack. And so most people, they do not know whether is it a heart attack, is it a panic attack. And so until they go to the doctor and the doctor checks them out and says, I think you had a panic attack. So it is important for you to understand when you have a panic attack and you have them many times, then you can be diagnosed as having a panic disorder. And then what happens, your body becomes used to the panic. So the moment you have a little fear, something, it just shoots up to 100 because your body is used to that panic. And this usually causes people now to be anxious about having a panic attack. Then we have social disorder, so social anxiety disorder. And this is where people are afraid to be in social situations. So the extreme of social disorder is anxiety disorder is that person cannot even go to work because they fear being around people. What is that about? Sometimes the fear is triggered by fear of embarrassment, fear of saying the wrong things, fear of not knowing what to say, fear of not being able to work and actually do a good job. They just feel anxiety. They feel apprehension being around people. And those are the people, if they do not take care of themselves and take care of this social anxiety disorder early, then they end up not leaving their house. We have known people who will stay in the house day in, day out, even for a whole month. They only come out to go and eat and go back to their room. And so that is what we call social anxiety disorder. And these people, they have overwhelming worry about how they look and how people see them. They have a narrative in their mind that people are constantly judging them. And unfortunately, if it is not treated, it can also move into where they actually feel like they can hear people are talking about them. So the embarrassment and being judged, those are the two things that they are constantly afraid of. Then we have specific phobias like being afraid of flying, being afraid of heights, being afraid of going into the next floor, living in in an upper floor. People just don't feel that they can deal with that. And it can also be a fear of, there are other specific phobias like the fear of snakes, the fear of spiders, all kinds of fears that actually paralyze you. You can't move. When that stimuli is presented before you, you cannot function at all. Then we have what we call agoraphobia. Agoraphobia is the fear of being in enclosed places where, like lifts, there are people who can never take the lift. If it is 20 floors, they would rather walk because they are afraid of all kinds of things. And they feel like when I'm in there, I cannot breathe. And that causes them to feel a panic. They feel anxious, and sometimes it can trigger a panic attack. And so you will find them that they are going to avoid those kinds of spaces. Now, agoraphobia can also be a fear. It can also trigger social anxiety because then when you have to be around a space where there are too many people, then also you think that there isn't enough air for everybody to breathe. And so you might find yourself thinking that you need to escape the space in case there isn't enough air. So matatus or public transportation, when you are in that car, you also think that air might not be enough. It's closed, it's too closed, and you might find yourself avoiding that. Now, children have what we call separation anxiety. And separation anxiety is where when you leave the home and your child sees you leaving, they scream, they cry, because the child has not normalized that when mommy leaves, mommy is going to come back. And so that is what we call separation anxiety. And that one can also be with adults, people who are afraid of being rejected, being abandoned. We can call that separation anxiety, where somebody who is close to you, when they are away from you for long periods of time, you struggle with that. You find a lot of anxiety. You begin to wonder, what are they doing? Where are they? Why are they not calling? If you call them, they don't answer. You begin to create some certain pictures in your mind, and that causes you to be very afraid. And that is part of what we call separation anxiety. Other things that we have seen, sometimes your anxiety is triggered by medications that you are taking, and it's important for you to whenever you have those symptoms, especially panic attacks, anxiety attacks, it is good for you to see your doctor if you're taking any medications. Make sure that you look at the side effects of the medication in case that is what is causing it. Now, the other thing that I want to talk about here before we end this segment is PTSD, post-trauma stress disorder. It's also a disorder that is in the spectrum of anxiety because it's triggered by trauma, by things that you have experienced in the past, and your brain has never been able to bounce back to normal. And so whenever you are triggered, when there is a stimuli that triggers that memory, that your body goes back into re-experiencing what you experienced during the traumatic experience. And so it is important, if you have like the death of a loved one, when you have your parents who died in an accident, or you have a boyfriend who died by committing suicide, or a lover who died by committing suicide, or you are involved in a situation where your safety was compromised, sexual violence, things like those, even being mugged in town while you are walking, or being beaten up, or anything that causes you to feel unsafe, it can be a trigger to PTSD. And the way that we diagnose PTSD is if you are still feeling intense feelings of unsafety 6 months, a year after the situation happened. And so we want to treat you for those kinds of things. There is one that everybody talks about. It's called OCD. Everybody says, me, I have OCD. And we don't understand that real OCD is a mental illness and a mental disorder that causes a person not to be able to function. And OCD is O stands for obsessive, and C stands for compulsions disorder. So how it looks like is that I'm afraid of being sick. And because I'm afraid of being sick, then I have a behavior that I do so that I can take away the anxiety of the fear. So for instance, I'm afraid of germs. So what do? Immediately I go out, I come back, I don't want to say hi to anybody, I'm not touching anything. But the moment I enter into the house, in order for me to take away the anxiety of I am going to get germs and be sick, I have to wash, I have to remove my clothes from outside the house, or I put them somewhere where until I have washed, until I have cleaned myself, I don't feel like I am safe. And so again, with OCD, I know we throw this around, but real OCD is very debilitating, and people with that disorder are unable to function in life. However, there is a mild OCD where I get very frustrated and angry if things don't go the way that I want them to go, if people don't follow my instructions. It doesn't matter whether the end result is good. It is the process that is very important to me. And that is part of perfectionism that causes us to have anxiety. And so people like that, they may be diagnosed with attention deficit disorder or hyperactive disorder, because they are always on edge. They are very hyper when it comes to things. And so those are some of the anxiety disorders that are on the books, and it is very possible for you to have a good assessment and a good diagnosis